Happy New Year! We made it to 2026. It's a pretty exciting time, and if I haven't met you before, I'm David Stockwell, the Medical Center Director here at VA Northern California Healthcare System, and it is really exciting to be part of 2026. Way back in life, I don't think I could have imagined 2026 and, hovermobiles and Back to the Future scenario, but here we are. Time flies and we're in 2026. And so you might be thinking, all right, what's happening at the VA Northern California Healthcare System as we welcome in the new year? And I hope all of you know by now that we have made 2026 the year of veteran satisfaction. We're reminding ourselves through our healthy home that it's all about the veteran. Everything we do, all the policies we put in place, all the practices that we do, all of the ways that we go about interacting, they're all in support of the veteran. We're partnering with them in their healthcare. We're just here trying to assist them and partner with them. And so we're asking every single person in our healthcare system in 2026 to do something specific to improve veteran satisfaction. Is there a way that we can cancel fewer appointments and actually see patients rather than making them, rescheduled and disappointed that they were counting on a healthcare appointment that they didn't get that day? Is there a way that we can improve communication so that we understand if a veteran can't make their appointment and we can give it to a different veteran instead? Or we can share with veterans the location move of their appointment, or if it's confusing, whether they show up in person or it's a video appointment, how do we improve that communication? If we've got lab results that we need to share with the patient, if we have updates about their pharmaceutical regimen or prescriptions, how do we take and better communicate with the veteran? Is there a way that we can improve our listening skills during clinic interactions? So the typing at the computer versus some version of ambient dictation that can capture those experiences to be able to dedicate more focused time towards the veteran. Whether you work in administrative areas and you're thinking, I don't directly interact with the veteran, but you do. You're here as a Veteran Healthcare Administration employee, and everything that we do can and does ultimately impact the veteran experience. So thinking about how can I improve that veteran experience is a task for all 5,000 of us in 2026. I'm pretty excited to see how that's going to play out, how it'll impact our veteran satisfaction scores in our healthcare system, and frankly, when we stay true north to our mission to serve those who've served our country, it actually makes our work experience more positive. So we can enjoy 2026 a little bit more as we're serving veterans. There's a few goals that we put for ourselves in 2026 as a healthcare system that I hope that you're all kind of tracking and aware of. One of those is our repatriation for those that show up in a community emergency room, particularly those close around our hospital. And how do we get them to get admitted to the VA hospital? It's better for their continuity of care, for their after discharge medical care needs, because they're a veteran patient using the VA system. So making sure that the meds are on the formulary, the DME is part of the pathway that we contract to, that we even know they need DME, and so it's a great idea to have veterans actually get their inpatient experience at the VA. It also saves our healthcare system money because buying hospital care on the outside, if you've ever paid for a hospital bill without insurance, you know that's an incredibly expensive scenario. And that's how the VA is paying for outside hospital care. And so we're trying to bring and repatriate veterans. Our goal is 150. Now we're already near 50 and we're right at the new year and we're counting fiscal year, so we're well on pace for 200 right now. But we set that goal, and so we're trying to continue to work towards bringing veteran inpatient care to the VA hospital as we're able to, and we're able to get the patients in here. So we're pretty excited about that. Part of that is opening those 5 additional beds. We've opened 3 of them already, 2 more to go. The staff is still joining us, and so as the staff comes on board, we're going to add those 2 additional inpatient beds, and that'll help us have space for those extra veterans as well. We also committed, I mentioned that our Stockton clinic is now the second biggest CVOC in all of Vision 21. And we saw completed 95,000 appointments in Stockton this last year. But we're still growing. We're still adding to the frequency and the scope of services that we're offering at that facility. And we have a lot of patient demand. Some of the services are scheduling patients months and months into the future for particular types of specialty care there in Stockton. It's been needed in the community for a long time, hasn't been available, and now that it is, we're seeing an overwhelming response for needs for service for patients. Our goal for 2026 is 110,000 completed appointments. So it's about a 15% growth over what we did last year. And so we're going to continue to work to offer new services available to veterans. And for those of you that work in our Stockton clinic, so excited to see the maturation of what's available there, the increase in quantity. Every time I go, the parking lot is a little bit fuller. I can't wait till I start getting questions in employee town hall meetings in Stockton about not enough parking, which I get at other sites frequently, but we have not had that problem in Stockton. But we're starting to fill up the parking lot each an active day of work. So those are a couple of exciting things we've got for 2026 in our healthcare system. We're going to continue to work very hard at lowering readmission rates, improving our catheter-associated urinary tract infection occurrence rate. We're going to try and improve our patient experience in primary care with the medical home. We're working hard with our care in the community team to try and make purchased care more seamless and better experience, and data capture of results from community care better. So we've got a lot on the plate for 2026. But it's about the people. So I mentioned stuff that we're doing, things that we're doing, but it's really about each of you, our employees here at VA Northern California, and the veterans that we serve. And so we want to make sure that we are valuing our staff. Let me just say thank you for the hard work that you're doing. When I throw out things like, we added 10% more completed appointments last year than the year before, we didn't have any more staff, which means the staff we had worked harder to make that happen. And so to be grateful for the commitment of the rallying troops, people are learning to cover in ways for each other. When somebody's out sick that day, somebody steps in from a different department, a different role, and covers. We've learned to wear multiple hats at work. And so we're rallying together to make sure that we're doing right by veterans. So I'm excited about 2026. I hope you are too. Happy New Year, and let's accomplish great things together in 2026.